Okay, here's a quick little demonstration for cleansing the wound, especially if you don't have a lot of supplies on you. It is a clean procedure for the most part. There are a couple sterile wounds out there, but for the most part it is a clean procedure. So, sterile piece of gauze, our little wound here, and some saline. Just gonna open it up, just like you're opening a banana. And I usually like to do it on a flat surface, and then you're going to pull and press. Good. Next, you're going to take your saline, especially if this is for if you don't have any forceps or a tray or anything like that to do your wound care with. This is a good way to try and maintain the best sterility that you can, or at least be as clean as possible. So you're going to pour the saline right in the center. The backing on this packaging usually has like a waxy base, and so it does protect from some moisture, and then it's paper. So putting a little bit of saline in the center there, you can see the wet mark. And then what you're going to do is, if you're really stressed for product, grab one corner, grab the other corner, pinch them together, and do it for all of them. And then what you're going to be doing is left with the base that's all wet. You're going to take your wound, and you're going to wipe from inside out, and then discard. Grab the next one, grab your corners, and again gently cleanse the wound. So your fingers are never really touching the moisture part, and you have a nice little barrier of dry gauze that helps, and it's just for light cleansing, but it's a good way to cleanse a wound if you're in a pinch for supplies. Okay, I hope that helps. Okay, so this one is if you have multiple wounds and you're using the clean gauze that usually typically comes in a stack to do the same thing that we just did. I usually discard the first one or two layers. I don't really like to use them. So what I'm going to do now is take my saline again. I'm going to pour a larger amount, but just leave it centered right in here. And what that'll do is it'll go all the way down to the bottom of the gauze. And I usually grab the corner, and what I'll do is I'll hold it like this and keep my fingers in a cup so that I'm holding the gauze, and so that my hand doesn't touch any of the wet part, because bacteria will transfer through. You know, my hands are all over the gauze to begin with, but I'm doing my best to try and keep it out of the center here. And then you can grab as you need it. And of course it can be difficult to grab all four. And then apply it to the one wound, discard, grab another one. And if you just pay attention to how my fingers are moving to grab everything you need. Now if you find that it's not holding itself, then by all means just hold it on an angle like this and have it dangle. Then your hands are nowhere near the area of the back, and then you can bring it up and use your finger if you need to let go and put it back. Okay. Grab the area, just keep your fingers away from the center, and of course the wound won't move because it's a person. Discard, grab another one. Always use your other hand to replace your thumb, and on to the next one. So I'll show you one more time. You can even do it this way if you need to. Thumb up, thumb down. Scoop the corner, grab, there you go. Okay, I hope that helps if you have multiple wounds. This really works because now you have lots of gauze with saline, and instead of back and forth, it's a stack, and you can either hold like this and provide some spacing behind the wet spot, or dangle it and then use both hands to get the job done. Okay, let me know if there's anything else you guys want me to show you. Alright, this is if you have some stuff some slough that's stuck to your wound and you're just having a difficult time getting it off, and you want to use some Q-tips, some 6-inch Q-tips. So you'll have opened your sterile gauze. You can open up your Q-tips. I usually like to leave it like this, that way this part remains sterile. However, we're going to be pulling both out, so a little farther, out like this. Hold the end over gauze. That way you're not making a mess. All right, and then hold your first Q-tip straight up so you can keep an eye on it, and then wipe and rotate to try and get that slough off. And then wipe and rotate if you need to try and get it off. Okay, and those are some different ways of cleansing a wound. Thanks for watching.